Good afternoon, everyone. Welcome to the symposium on PRX Plus. And first of all, I'd like to thank the WIQO team for inviting Dr. Guy and I to present to all of you today. It's really an honor and privilege. Now, it's our first time to do a tandem lecture. We are in husband and wife team, so this is going to be interesting for us as well. Okay, so I would like to start this symposium by asking the audience a question. Okay, so if you are faced with a patient who would want to have skin rejuvenation, uh, if you want to impress, what procedure are you going to do? Who would want to do injectables? Raise your hands. And who would want to do non-injectables? Okay, so I see more injectable people today. Now let's take the point of view now of the patient. Given that either injectable or non-injectable will create the same result, what do you think patients will choose? Of course. And you know, the modern patient today have a very active lifestyle, and of course, uh, they don't want the downtime. They don't want to they don't want their daily activities to be affected, and thus, no, something that is non-injectable, something that does not cause the pain, the downtime, and peeling is something that they would probably choose. And for today, we'll be discussing this next generation, this unique and novel aesthetic treatment that actually will redefine skin quality that will fit our modern patients. We'll realize that there is this treatment that can improve skin quality, while at the same time, without the needles, without the pain, without the downtime of bruising, and of course, the peeling of the skin. And that will understand that this procedure can be safely done together with our favorite aesthetic procedure treatment. So good afternoon. We are Dr. Alvin Jorge. I'm Dr. Alvin Jorge, and uh, also with me is my lovely boss and wife, Dr. Gia Favor Jorge. And we are actually, well, Dr. Gia is a dermatologist, and I am a cosmetic surgeon, gender affirmation surgeon. I also do a lot of non-surgical aesthetics, and I'm the employee number one of Dr. Gia. Anyway, we are also connected with a training center, the Aesthetic Center for Excellence, and we do train doctors in different non-surgical aesthetic procedures such as fillers, threads, toxins, and this would be one of them as well. Now, just to give you a background on PRX Plus, this was introduced in our country, the Philippines, just last June of last year. And safe to say that since the launch, there have been rave reviews, not only by doctors, but also the patients themselves. And I guess for the Asian skin, which is quite sensitive, if it is very effective for the Asian skin, then I think this is a very good treatment that we can do. Now, today's discussion will first look at the emerging trends in aesthetics, and we'll understand why skin quality is a very important treatment outcome. As a cosmetic surgeon, I am now realizing that skin is just as important as the deeper structures. Now, we'll also look at and discuss the benefits and the indications of PRX Plus. We'll also review the science behind its unique formulation, and we will examine the unique application technique because this is very important as well. Of course, the protocol is just as important. doing the full cycle, and very important also is the home care program. And here we'll also explore the versatility of PRX Plus as a standalone treatment and in combination with our favorite aesthetic treatment procedure as well. Now, traditionally, aesthetic medicine was heavily focused on replacement. So if there's loss of volume, we replace with fillers. If there are wrinkles, we do toxins. And if we want to lift the skin, of course, we do threads or even energy-based devices. Now, of course, while these treatments remain very valuable, patients and doctors have been looking for something more, something that will create natural-looking effects. Of course, they want long-term improvements. They want healthy skin. And this is probably why regenerative aesthetics has become one of the fastest growing areas in our field. You know? So now the focus is shifting towards stimulating the skin's own regenerative processes rather than simply replacing what was lost. So when we discuss skin quality, what do we actually mean? Well, we have to understand that skin quality is multidimensional. No? It includes firmness and elasticity. It includes surface smoothness and pore appearance. It includes even pigmentation. And it also includes luminosity and glow. Now, this is probably why injectable skin boosters were developed. And this is to address the growing need of skin quality enhancement. They improve hydration, elasticity, radiance, and overall skin texture. However, these injectable treatments have their limitations or downsides. Of course, they will require needles, as the word implies, injectables, right? And needles can cause discomfort, and they produce bruising, and of course, downtime. And with the modern patient now, very active, they don't want time away from their daily activities. They want something that is probably non-injectable, no needles. So basically, we just need more options. So if we listen carefully to the wants of patients, we would notice that there will be this consistent pattern that will emerge. Patients would want natural looking results. They want brighter, smoother, healthier skin, and they really don't want the downtime. And as doctors, of course, we would want to have high satisfaction of our patients, and thus we will need safe and effective, predictable treatments. And of course, we want treatments wherein we can combine with our favorite aesthetic treatment procedure. Of course, this is where PRX Plus will come in. And this, when I discuss about results to patients, I often focus on 4 key outcomes. First is immediate glow. Many patients notice improved radiance immediately after the treatment with PRX Plus. Second is a noticeable pore refinement and smoother texture. Third, there's improved elasticity and firmness. And fourth, there's better hydration and overall skin quality. And of course, with PRX Plus, you will have skin that looks refreshed, it looks brighter looking, and healthier looking. And all these with the advantage of not having to use needles. There's no visible peeling that is noticed, and thus there's no pain as well. It can be used all year round, regardless of the season. And since it can be used on all skin types, it's perfect for the Asian skin. It is quite an easy procedure to perform. And even though it's quick, it's easy, it still creates immediate and long-lasting results. And so now let's discuss the benefits and indications for PRX Plus. Now, PRX Plus is a professional cosmetic that targets to improve the skin appearance. Okay, it has a unique formulation that helps promote smoother looking skin, noticeable luminosity that is needle-free, and with measurable results. Its main effects are it helps improve the appearance of uneven skin tone, it contributes to a smoother and more refined looking skin texture, it also helps minimize the visible appearance of these pores. And as we have mentioned, for the modern patient, doesn't want the downtime, doesn't want the pain. If we can achieve all this without the pain, without the downtime, then definitely this is an intelligent and a modern option for those who would want to have higher skin quality. Now, the clinical effects of PRX Plus can be centered on the major pillars of skin quality. So patients would typically experience an immediate enhancement of luminosity. You'll notice an immediate glow. This is followed by improvements of pigmentation, pore appearance, hydration, and skin firmness. And this all happens while there's epidermal renewal and dermal remodeling. Okay. Indications, who are patients that are best to have PRX Plus? These are those that have dull skin, those that have hyperpigmentation, those with enlarged pores, those who lack hydration, loss of elasticity, and simply for those who want an immediate glow of their skin. And PRX Plus does enhance the look of firmness. It helps to even skin tone and refine skin texture. And it does leave the skin revitalized and refreshed. And to identify these are patients that have lack of elasticity, those that have hyperpigmentation, those that have dull skin, as well as those that have enlarged pores or excess sebum formation. Of course, we have to understand the unique formulation of PRX Plus because this is really the secret. And as they say in culinary arts, the secret is in the sauce, right? So let's try and understand the formulation because this is a carefully designed formulation that combines regenerative stimulation, brightening effects, and skin quality enhancement. Now, of course, this individual ingredient plays a specific role. However, it is actually their synergy that ultimately produces the clinical results that we observe in our patients. So, the PRX Plus formulation contains three major components. First of which is the 33% ammonium trichloroacetate. It is the ammonium salt of TCA, and thus it does behave differently compared to TCA. It has minimal damage to the epidermis and thus support skin firmness, elasticity, and overall skin quality. Next would be the homocysteic acid, which cause the modulation of your NMDA receptors that influence the keratinocytes and fibroblast responses to a controlled chemical stimulus such as the ammonium TCA, and this contributes to the brightening and helps improve the uneven pigmentation of the skin. And third would be the citric and the phytic acids, which act as antioxidants, and they contribute to the formulation stability and thereby supporting smoother and brighter looking skin. Now, PRX Plus is the only professional product with homocysteic acid in the entire cosmetic market, and that the combination of ammonium TCA and homocysteic acid is a patented formulation by WIQO. So first, let's talk about the ammonium trichloroacetate. It is the key ingredient for the regenerative effects of PRX+. Again, it is the stabilized form of TCA and thus behaved differently because of its altered acid availability. It does cause minimal damage to the epidermis, and that's why peeling is not really noticed or visible. So, of course, it provides a controlled stimulation of the skin and thus promoting improvements in skin texture, firmness, and maintaining barrier function, and while respecting the integrity of the epidermis. No? Now, this allows us to achieve smoother, healthier, and more resilient skin through its regenerative approach with minimal irritation or downtime. Homocysteik acid, on the other hand, is the hero ingredient of PRX+. With the appropriate formulation that was done with WIQO, homocysteik acid functions as an NMDA receptor agonist. Now, in keratinocytes, the activation of this NMDA receptor supports cellular self-regulation, regeneration. It accelerates the epidermal turnover while maintaining the strength of the skin barrier. Now, in melanocytes, NMDA receptor modulation influences the melanocyte activity as well as melanin turnover or transfer, and this will contribute to the brighter and more even complexion of the skin. So, definitely, its unique formulation is very important in creating these effects. However, just as the secret is in the sauce, the way is it that it is cooked creates the perfect dish. And that's why it's very crucial to perform the treatment properly, follow the protocol, do the home care treatment, and understand its treatment versatility. And to discuss this unique application technique, may I now call on Dr. Gia Favor Jorge.
Okay. So, the PRX Plus treatment is simple, standardized, and it's designed to maximize treatment efficacy. So it consists of 3 essential steps. So it's cleanse, apply, and moisturize. So first, we have to cleanse the skin using the WIQO P solution. So this prepares the skin by optimizing the tissue environment and ensuring that the even or uniform penetration of its active ingredients. Second, this is the application of the PRX Plus using the unique WIQO massage technique. So this technique facilitates the transcutaneous absorption and activation of the regenerative process. And finally, we have to wash off the excess product with water and apply the WIQO nourishing and moisturizing cream. So this cream restores the hydrolipidic layer, and it reduces transepidermal water loss, as well as provides the optimal environment for the regenerative process of PRX Plus to continue even after the procedure is done. So this technique is one of the defining features of PRX Plus. So several key principles should be respected. So number 1, we should always use nitrile gloves rather than latex. We begin with a small area to assess the skin response. We have to ensure adequate lubrication throughout treatment to avoid unnecessary friction. We also use our hands almost like a spatula to maximize contact between the product and the skin. And we should massage following lifting vectors using unidirectional movements. And finally, we have to apply consistent pressure throughout the procedure. We usually use 1.5 kilograms of pressure. And these details may seem minor, but they are essential for achieving reproducible outcomes. So as with any professional treatment, patient selection remains critical. PRX Plus should not be used on irritated, inflamed, infected, or compromised skin. We should avoid treatment in active dermatitis, open wounds, active herpes eruptions, or known allergies to product components. Pregnancy and breastfeeding remain contraindications. Patients using topical retinoids should discontinue use approximately 2 weeks before treatment because careful patient selection helps ensure both safety and optimal outcomes. So I'd like to walk you briefly through the PRX Plus application protocol. So one of the advantages of this treatment is that it is simple, reproducible, and can be easily incorporated into our daily clinical practice when the proper technique is followed. Okay, so first, we have to begin by identifying the areas where we should avoid applying the product. So earlier, it was the lateral canthi, the nasolabial folds, and the marionette lines. So we begin with cleansing and prepping the skin using the WIQO P solution. Then next here, we apply the PRX Plus using the WIQO massage technique. So the product is massaged using slow unidirectional movements that follow the facial lifting vectors. So this controlled application is essential because the massage facilitates uniform transcutaneous absorption. So as I've mentioned earlier, we need to use nitrile gloves in this massage technique and apply 1.5 kilograms of pressure. And it's essential to remember that we do not use the tips of our fingers. So we should put our fingers together so that our hand will act like a spatula. And we will know that it's time to apply the next layer because the skin feels sticky or tacky. So for all the areas, for the forehead and the cheeks, we usually use 3 layers. Now for the chin, the upper lip, the nose, and the periorbital areas, it's just 1 layer each. So when we apply the PRX Plus on the under eye and on the upper eyelids, we usually use 1 drop on the hand and then apply it on the areas just to make sure that there's no accidental application on the eye. Next, after the PRX Plus is well absorbed, we just rinse off with water and apply the WIQO Nourishing and Moisturizing Cream. Wait, it went back. Okay, so now let's discuss the treatment cycle itself and why home care plays such an important role in maintaining and amplifying the results. So the standard PRX Plus protocol consists of approximately 4 sessions. So the sessions are performed every 14 days or 2 weeks, and treatment time is very efficient. So if we just apply on the face, it's just 10 minutes, but if you want to include the neck, that's additional 5 minutes, so a total of 15 minutes for the face and the neck. And the second cycle can be repeated after approximately 6 months. So this slide, it explains why multiple sessions are recommended, because as we know, collagen production is not instantaneous. So following treatment, fibroblasts become activated within the first few days. Pro-collagen synthesis begins during the first week. Collagen deposition continues over the following weeks, and dermal remodeling and thickening occur progressively over the subsequent month. So each session builds upon the previous one. So rather than the effect fading between treatments, the regenerative response accumulates. So this is why there's visible improvements continue to develop throughout the treatment cycle and often continue for several months after completion. So successful regenerative treatments do not end when the patient leaves the clinic. We should think of the treatment as a complete system consisting of 2 parts. So the in-office procedure that we do, it initiates regeneration, and the home care program helps maintain and reinforce those biological changes. So when patients follow both components consistently, results tend to be more long-lasting and predictable. So this transforms our approach from simply just delivering a procedure to guiding a complete skin quality journey. So the WIQO Nourishing and Moisturizing Cream is one of the most important products that we use after the procedure because it's specifically designed to complement the PRX Plus treatments. It is a rich emollient moisturizer whose primary goals are to deliver deep hydration, prevent transepidermal water loss, and restore and support a healthy protective barrier. So the key ingredients include shea butter, jojoba oil, wheat germ oil, grapeseed oil, and echinacea extract. Each ingredient contributes a specific function. So shea butter provides intensive hydration and barrier reinforcement. Jojoba oil balances the skin's natural lipid composition. Wheat germ oil supports repair processes while providing antioxidant protection. Grapeseed oil contributes regenerative and antioxidant benefits. Echinacea extract is particularly interesting because it inhibits hyaluronidase activity, thus helping preserve endogenous hyaluronic acid within the skin. So collectively, these ingredients create an environment that supports recovery and prolongs our treatment benefits. So after application of the nourishing and moisturizing cream, hydration was improved within 24 hours. So this was seen in a clinical trial. So skin elasticity also improved after 30 days of use. But most importantly, transepidermal water loss was reduced. So these findings suggest improved barrier function and more efficient moisture retention. So this slide explains why the WIQO Nourishing Moisturizing Cream is an essential part of the PRX Plus protocol. So as shown in the clinical trial, the application of the cream reduced transepidermal water loss by approximately 10% within just 5 minutes and by 21% after 30 days of continuous use. So now that we've discussed the science, the application technique, and the complete treatment protocol, let's move to one of the most exciting aspects of PRX Plus. So one of the greatest strengths of PRX Plus is its versatility. So unlike many treatments that are limited to either a standalone or a combination role, PRX Plus performs exceptionally well in both settings. So as a standalone treatment, it delivers progressive improvement in skin quality, texture, firmness, and radiance through a series of sessions. However, where I believe PRX Plus truly shines is as a treatment amplifier. It integrates seamlessly with many of the procedures we already perform daily, like microneedling, radiofrequency, lasers, injectables, and energy-based devices. So this flexibility allows us to customize treatment plans according to patient needs, whether they want gradual skin improvement or accelerated results through combination protocols. But before we discuss combinations, we have to review what PRX Plus can do to our skin on its own. So as Dr. Alvin has mentioned, it improves skin firmness, it refines texture, enhances radiance, and promotes a more even skin tone. And more importantly, it achieves these benefits with minimal downtime, making it highly acceptable to patients. So let's first look at what PRX Plus can accomplish as a standalone treatment. So the following cases will demonstrate why PRX Plus has become such a valuable addition to our treatment armamentarium. So even without adjunctive procedures, we can see meaningful improvements in overall skin quality. So in this first patient, after 3 sessions, we can appreciate improved skin brightness, smoother texture, and better overall skin quality. So notice also how the skin appears healthier, more refreshed, and this is not merely a superficial glow. We are seeing the cumulative effects of dermal stimulation and skin remodeling. Male patients also, they're seeking treatments with minimal downtime. So after 3 sessions in this male patient, we can appreciate improvements in skin texture and overall skin quality, including a brighter complexion and healthier looking skin. In this patient, after 3 treatment sessions, we observed progressive improvement in skin tone uniformity, surface texture, and luminosity, reflecting the cumulative regenerative effects of PRX+. So the skin appears healthier, more hydrated, and better able to reflect light evenly. In this patient, the most notable changes are the improvement in overall skin texture, radiance, and skin tone uniformity following 3 sessions of PRX+. Again, the skin appears healthier and better hydrated with improved light reflection and reduced signs of photoaging. So here we can appreciate progressive improvement in skin texture, radiance, and the appearance of fine periorbital lines with continued enhancement even 1 week after the final session. This is the contralateral side of the same patient, demonstrating consistent improvement following 4 sessions of PRX+. We can appreciate smoother skin texture, improved radiance, and softening of the superficial periorbital lines. So these findings highlight the cumulative regenerative effects of PRX+, where improvements continue as collagen remodeling and skin renewal progress beyond the last treatment session. So one of the hallmarks of regenerative treatments is that the skin continues to improve after the procedure. So rather than providing a temporary cosmetic effect, PRX Plus stimulates ongoing skin remodeling, leading to healthier, brighter, and more refined-looking skin over time. So this case demonstrates one of the unique advantages of PRX Plus, its ability to produce an improvement in skin radiance immediately after treatment. So while significant pigment clearance should not be expected after a signal session, we can still appreciate a brighter complexion, improved skin luminosity, and a healthier overall appearance, which is largely due to enhanced hydration, smoother skin texture, and improved light reflection. So this immediate glow effect, as also seen in these patients, is one of the reasons why PRX Plus is an excellent option for patients preparing for important social events, while continued treatments provide the progressive regenerative benefits of improved skin quality. So now we move into the most exciting aspect of PRX Plus, its role in combination therapy. Because modern aesthetic practice is increasingly focused on synergy. So rather than relying on a single treatment modality, we combine technologies that address different layers and mechanisms. So when we look at aesthetic concerns, patients of ours rarely present with just one problem. So a patient with skin laxity often has textural issues. Patients with pigmentation frequently have enlarged pores, and those with wrinkles often have volume loss. So because of this, combination therapy has become the standard in modern aesthetic medicine. PRX Plus serves as a versatile platform that can be combined according to the patient's primary concern. So for sagging skin, we can combine it with threads, HIFU, RF. So for pores and texture, microneedling and RF microneedling are excellent partners. For pigmentation, lasers and mesotherapy can be incorporated. And for deeper wrinkles, fillers and neuromodulators complement the effects of PRX Plus. So rather than replacing these treatments, PRX Plus enhances the overall treatment outcome. So among the all combination protocols, PRX Plus with microneedling is probably the most frequently performed in clinical practice. So in the following video, you'll see how PRX Plus is incorporated into the microneedling protocol and why proper application technique is important for achieving consistent results. So before we begin the microneedling procedure, of course, we have to cleanse the skin, and a topical anesthetic is then applied to ensure patient comfort during the procedure. So after the numbing cream is removed, wait. Alvin. Ayan. After the numbing cream is completely removed, the skin is cleansed once more with the WIQO solution. So, and it's thoroughly dried after. So PRX Plus is then applied manually using the WIQO massage technique until the product is fully absorbed. So again, we apply 3 layers on the forehead and the cheeks, 1 layer on the chin, the upper lip, the nose, and also the periorbital area. Yeah, so again, in applying PRX Plus on the periorbital area, apply it first on the glove, just a drop, and then apply on the lower lid. Massage it lightly, not with 1.5 kilograms of pressure, and the upper lid as well. So once the PRX Plus has been absorbed, NCTF is applied 1 treatment area at a time. Then, microneedling, as seen in the video, is performed over each area, allowing the regenerative effects of both PRX Plus and NCTF to work synergistically while stimulating collagen production through controlled dermal injury. So we usually just do 1 pass of the microneedling technique and just 0.25 millimeters depth. So after completing the procedure, the skin is rinsed with water. So this combination protocol addresses skin rejuvenation through multiple complementary mechanisms. So PRX Plus enhances skin regeneration and skin quality. NCTF provides the essential nutrients and hyaluronic acid to support cellular repair, and microneedling stimulates collagen remodeling through controlled microinjury. So looking closely at this patient, we can appreciate progressive improvements after each treatment session. So the skin appears brighter and more even in tone, with a smoother texture and refinement of the pores, particularly over the cheeks. This patient presented with post-acne scarring, enlarged pores, and an overall uneven skin texture. So following just 2 sessions of PRX Plus combined with microneedling and NCTF, we can appreciate progressive improvement in skin texture with shallower acne scars, smoother skin, and a more refined pore appearance. His skin also appears brighter, more even in tone, and healthier overall. So compared with the baseline, this patient demonstrates visible improvement in superficial acne scars, pore size, and overall skin texture after 2 treatment sessions. So the skin appears more even with increased luminosity and healthier complexion, reflecting the synergistic effects of collagen remodeling from microneedling, biorevitalization with NCTF, and regenerative skin stimulation with PRX Plus. So this case demonstrates the synergistic effect of combining PRX Plus with an injectable skin booster. So while the injectable skin booster primarily improves dermal hydration and skin elasticity, PRX Plus complements these effects by enhancing epidermal renewal, skin brightness, texture, and overall skin quality. So just after 4 sessions, we can appreciate a more even skin tone, improved radiance, better skin texture, and healthier overall appearance. That highlights how combination therapy can address multiple dimensions of skin aging simultaneously. So radiofrequency and PRX Plus target different complementary pathways of skin rejuvenation. So density RF induces controlled dermal heating, stimulating neocollagenesis and tissue remodeling, while PRX Plus activates regenerative pathways and improves epidermal cell turnover. So together, they address both skin firmness and skin quality, resulting in brighter, smoother, and more refined-looking skin over time. This case highlights the benefits of combining PRX Plus with a picosecond laser for patients with pigmentation concerns and overall skin quality issues. Pico laser primarily targets unwanted pigment through photoacoustic energy while also stimulating collagen remodeling, whereas PRX Plus enhances epidermal renewal, improves skin tone evenness, and supports the regenerative process. So as we progress to the treatment sessions, we can appreciate improvements in pigmentation, skin brightness, texture, and overall complexion, demonstrating how the two treatments work synergistically to achieve a more comprehensive rejuvenation outcome. Now, with fractional thulium laser, which primarily targets pigmentation and textural irregularities by inducing controlled epidermal and superficial dermal remodeling, when combined with PRX Plus, which promotes epidermal renewal, growth factor stimulation, and barrier optimization, we are able to address both photoaging and skin quality simultaneously. The result is a synergistic improvement in pigmentation, skin radiance, texture, and overall skin rejuvenation. So as we conclude today's presentation, I would like to leave you with one key message. The future of aesthetic medicine is defined by improving skin quality. PRX Plus allows us to achieve this through a unique regenerative approach that not only delivers excellent results as a standalone treatment, but also amplifies the outcomes of the procedures we perform every day, whether it's microneedling, radiofrequency, lasers, injectables, or other energy-based devices. Because by improving the foundation of the skin, we enhance the overall outcome of every treatment, leading to healthier skin, more natural-looking results, and greater patient satisfaction. Because when skin quality improves, every treatment performs better. Thank you.
Thank you very much, Dr. Gia. Maybe you can join me here. Have a seat while everybody watches us here in front of the stage. Now, I think we have time for an open forum. So, if there are any questions from the audience, there is a mic in front, or maybe some of the staff can go in to you to ask the questions. Yes, doctor.
Yes, I did PRX Plus first with the layers, and then I applied NCTF and then microleading on top. Yes, 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 doctor. So you cleanse after. Yes, doctor. Yes, with laser devices, yes, you can do PRX Plus. Usually, you can do on the same session. Um, I think it's a rule of thumb that when we insert something, like if we do threads, fillers, or toxins, we do the PRX Plus first and then the injectables. If we have energy-based devices or lasers, we do the PRX Plus first a week before the laser. So, yes. Yes, a gap of 1 week. Yes.
Other questions? Yes. How do you assess the amount of improvement that you get? Maybe, yes, maybe our the scientific director of WIQO, who's done a lot of research on the PRX Plus, would explain it.
To be honest, we didn't quantify the difference in between PRX Plus microneedling and PRX Plus microneedling and CTF. We did it with another device based on exosomes, and we did a comparative study. But for sure, we are planning to do the comparative study also with products like NCTF. We had our first peer-reviewed publication 1 month ago on Pyrrhix Plus and microneedling, and we already have the draft on Pyrrhix Plus microneedling exosomes. So we are exploring different kind of association because we know that the patients, most of the time, they want all it done in the same session. So we are trying to see what is possible to do in putting everything together so that they don't have to come every 2 weeks, but we can space the sessions once a month, for instance. So I cannot quantify, but we did they did a lot of treatments with NCTF plus microneedling and CTF, and personally, even in the European area, we did a lot of this combination, and we have great results. I can just say it qualitative, but not quantitative. Okay.
Thank you, Dr. Deborah. Other questions? Yes, stop.
Yes, actually, the PRX, the emollient cream is um, it's very effective even if we have a little bit of oily skin. So it doesn't really clog the pores, so the patients are really happy with using it. But although I think WIQO will be coming up with a PRX that's really specific for acne, and they have a specific cream that will go with it. So of course we cannot use the PRX Plus with active, acne, yes. But yeah, they have a specific cream for that. But it doesn't really cause breakouts because I've had patients who've had post-acne scars, the one that you saw with the 2 patients, and they didn't have breakouts after. So they were okay. I recommend it as long as we're doing the treatment, the protocol. And some patients even, yes, all throughout. And our patients really love the effect of the moisturizer that they even continue using it even if they're done with the protocol. Yes, so usually because we have to stop the tretinoin 2 weeks before, and then we have to have the PRX again after 2 weeks. So it's best that we do it in patients where their acne is already controlled. Yes, and then they can just resume after the treatment cycle. So they don't get confused as well. Then I have to stop and then I have to apply.
Yes,
The-
Doctor.
Yeah. Well, actually, it's surprising that the patient doesn't feel any that much stinging as we would tend to expect because it's after microneedling creating those injury. Yeah, yeah, no, it's does not sting that much. Yes. No, 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 because we just do one pass of the microneedling, and we use the shallowest depth, the 0.25 millimeters only. Yes.
Oh,
Yes, doctor. Usually, if you do the laser, it's usually can do the laser before, then the PRX after, if the patient really wants to do it on the same day. But of course, you have to check the response of the patient because sometimes after thulium or after pico laser, their skin is very erythematous. So if it's like that, they may be more sensitive, then it's best to do it separately.
yes, question, Doctor.
Yes. Yes. After we wash, we rinse off the excess product, and we apply the moisturizer and the sunscreen if it's the sun is still up. Then the patients can wash their face even after 4 to 6 hours. The next one. So usually after the protocol, the effect of the skin is it's stabilized. So there's continuous improvement that we can do the next treatment cycle after 6 months.
So basically, twice a year. Other questions? Yes, doctor.
No, doctor. So you do it straight. So after the applying the layers of the PRX plus, apply the NCTF, do microneedling, do the whole face, and then that's when you rinse off. Yeah, so or pat dry.
As a standalone treatment, you don't need. You
No
don't
need
need.
to, no need to.
No pain, as mentioned.
There's a little, we can experience a little bit of stinging, especially if the skin of the patient doesn't have a healthy barrier. But it's usually around like 1 to 2, only or if there's pain, it's just 1 to 2. And it immediately goes away. So when you start on the forehead, they feel a little bit of a sting. But then when you start on the cheek area, it about fades or goes away already. Unless the patient will feel like there's a burning sensation and you'll see that her skin is really red, then you have to wash off after or discontinue the treatment and apply the moisturizer right away. But we've been doing it for the past 3 years and we haven't experienced the burning sensation. Yeah. It's very well tolerated.
Yeah, and it's quite interesting that doctors are usually concerned because of the high concentration of the ammonium TCA because they're comparing it with the traditional TCA, and they would be expecting peeling, the protein denaturization, but basically you don't examine this because the ammonium salt of TCA behaves differently, really. So none of those things that, and it's not an endpoint that we're looking at, the frosting. You don't need to go to that point because it will not happen. Other questions? It's yes, doctor.
So if you feel like there's redness immediately, so of course immediately stop the treatment, rinse off with water, apply the moisturizer right away. And then if the patient's still red, probably make her apply a topical steroid or antihistamine. But yes, then again, we haven't had those kind of reactions.
And you see results immediately after. And that's why it's so easy for us to do a lecture on this because we see the results, we believe in the product. And I do suggest that you try it because the results will ultimately make you do this treatment. Other questions? It's been an interesting afternoon. Anyway, if there are no more questions, we'd like to thank the audience for joining us this afternoon, and we hope that you can try the PRX Plus. On behalf of WIQO, thank you very much.
Thank you.